Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Respiratory diseases, and you're looking at the IOC, that is the investigation of choice. So, in terms of the ILD, that is the interstitial lung diseases, the investigation of choice will be the HRCT. And when you look at the bronchiectasis, so here in bronchiectasis, it is again the HRCT which is done, that is the investigation of choice. And looking at the pulmonary embolism, so here in pulmonary embolism, it is nothing but the CT pulmonary angiography. So the CT pulmonary angiography. So this is greater than the ventilation perfusion scan. This is greater than the ventilation perfusion scan. Next is we call the calcification. So the calcification is primarily seen in the CT. Then we move on to the solitary pulmonary nodule. So here in the solitary pulmonary nodule, there will be the CT which is greater than the PET. And looking at the lung malignancy, so there is a lung malignancy. So in lung malignancy, again it is a CT scan which is done. And looking at the superior sulcus tumor, so in superior sulcus tumor, it will be the MRI scan which is greater than that of the CT scan. So the MRI comes first and then comes the CT scan. To learn and grow daily like this, please do subscribe.